And you may need to pick up an extra box of tissues during that weekend grocery trip.
The sniffles are spreading around, and Tracy Townsend shows us what doctors are seeing and what's going around.
This week, what's going around includes some of the typical illnesses you might expect: colds, sore throat, strep throat, and the flu. I talked with the medical director of Ohio Health's urgent care centers, who says his team is starting to see an uptick in flu diagnoses. They're seeing people walk into locations, including one of their two busiest right here in Grandview, with symptoms ranging from fever and body aches to congestion and sore throat. Dr. Glenn Williams says now is the time to get that flu shot because flu diagnoses start to build in October and November. While the month of February is typically when flu peaks, it's during the holiday season in December that comes in second for most cases.
Typically, flu is going to be spread by respiratory droplets. So cough, sneezing, even talking can produce some respiratory droplets. That's why it's so important, if you do have flu, to stay away from others, to kind of quarantine yourself, stay home from work, so you're not spreading it among other people.
The Centers for Disease Control and Prevention is reporting normal for flu season right now, but there is some concern that could all change for the worst. We'll have more on keeping your family safe tonight at 5:30. With symptoms of the flu. This month really does kind of kick off flu season, and we are talking about protecting your family in what's going around this evening. And it really is very simple. Medical experts agree the best way to do that is by getting a vaccination against the viral infection. The flu does spread easily. Coughs, sneezes, even hugs or handshakes. Boy, that is very easy. Ohio Health urgent care staffers say they are already diagnosing and treating more people coming in with those flu symptoms, which is why the medical director, Glenn Williams, says vaccination now is so good because it takes about 2 weeks for that medicine to get into your system.
We have really good evidence that the flu shot cannot give you the flu. The flu shot really is little particles that they break up to make your body respond to it and develop antibodies. There's no flu virus in the flu vaccine, just as well as there's no tetanus virus or tetanus bacteria in the tetanus vaccine.
That's really important to remember because people always say they get sick from the flu. Treating the flu is really about treating the symptoms. If you have a fever, you want ibuprofen or acetaminophen, for example. There is antiviral medication, Tamiflu. That is usually, though, reserved for people at high risk for complications. Those include people over 65, children who are 5 and under. Also, it includes people who have chronic conditions like heart disease or perhaps they have diabetes. And, of course, those groups are being urged to get a flu shot, and that's something you really want to talk to your doctor about just to make sure that is okay. Scott?